Welcome to Issues and Answers with Diane Kinderwater. Issues and Answers is presented as a public service to inform, educate, and better the lives of New Mexicans. And now, Issues and Answers with your host, Diane Kinderwater.
Welcome to the program. I'm Diane Kinderwater. I bet you experienced this. I bet you even said it. I know my friends experienced it, and they told me they said it. I experienced it, and I said it. When I tried to schedule an appointment for a medical procedure, I yelled in the phone, "I'm going to be dead before I could get in to see that doctor." You know what I'm talking about? It's true. It happened to me. It happens to my friends. It's happening all over New Mexico. Trying to schedule a procedure, a test, an exam, to see your doctor, to see a specialist, seems like it's impossible, or it seems like you could be dead before you get it. And I'm not laughing. It's actually a life and death matter. And it's a life and death matter that Think New Mexico has taken on. Think New Mexico is a result-oriented think tank serving New Mexico, and they are going to be a champion of trying to solve the way that we have fewer healthcare workers, fewer professionals here in New Mexico than we need. I don't have to tell you that. You've experienced it. Please stay with us as we talk to Fred Nathan Jr. about what Think New Mexico is doing for us during this current legislative session. We'll be back with hopefully some healthy news right after this. Stay with us. Welcome back to the program. Do you feel sick yet? I have some sickening statistics to give you, but again, there's hope because Think New Mexico, the result-oriented think tank, is going to be working on this in the state legislature. But did you know that we have the oldest physician workforce in the nation? 40% of the doctors are expected to retire in 5 years. How can you see a doctor then if they're not in the office? We have the second highest medical malpractice lawsuits in the country, second highest. And New Mexico percentage of people on Medicare, Medicaid, is the highest in the nation. So doctors receive their reimbursement from Medicare, Medicaid. How much is that? Well, if you're a physician or you know a physician, you know it ain't much. But we have some hope for you today and for me. We have Fred Nathan Jr., who is the founder, CEO, president of Think New Mexico. Thanks for being a part of the program, Fred.
Thanks for having me back on your show, Diane.
And of course, we're still in the new year, so happy new year to you and your family.
Thank you.
Think New Mexico, Fred's been on here before. They've worked on a number of big issues. Give us a quick little rundown of the issues that you've been successful with in Santa Fe with the legislature.
I think the issues that we're best known for is making full-day kindergarten accessible to every child in the state, repealing the tax on groceries, more recently getting the double tax on Social Security income off low and middle income New Mexicans, and ending predatory lending and bringing down the loan rate on small loans of $10,000 or less from 175%, which just creates a cycle of debt, down to 36%.
You're the founder and executive director of Think New Mexico. You call it a results. You show the results think tank serving New Mexico. Now you're just not sitting around thinking, you're doing something with all this research.
Right. The model's a little different than most think tanks, which is just, as you say, doing research and then crossing your collective fingers and hoping something good happens. That didn't seem that interesting to us when we started Think New Mexico. We really wanted to make a difference. So we combined the research with actually going across the street. Our offices are across the street from the Capitol, and lobbying for our recommendations. We draft our own legislation. We identify sponsors from both parties. And I guess that's the other way that we're different. You know, most think tanks that work on public policy issues are either way over on the left or way over on the right. We just believe in a state like New Mexico that's 49th or 50th in too many of these national rankings, that maybe the focus ought to be on solutions rather than political ideology. And consistent with that, we have a board of directors made up of Democrats, Republicans, and independents. I'm an independent. So,
who are working on these issues and been very successful. This one I asked, why are you just introducing it this year? We needed this years ago. A plan to solve the healthcare worker shortage. And I wasn't kidding when I really yelled into the phone when I tried to make a number of medical appointments this past year. Poor schedulers, I'd say, 7 months, 8 months, I can get in. I'm going to be dead by then. Have you heard this from your other?
Well, over and over again, we've heard this, that either
God.
I can't find a doctor, or I have a doctor, but I can't get in to see him or her. So, you hear about it anecdotally, and of course the statistics just jump off the page.
You hear the antidotes. Well, I'm an antidote.
Well,
I'm an antidote.
Well, just
It happened.
we lost 711 primary physicians in a 4-year period of 2017 to 2021. That's 30%.
We lost that many physicians.
Yeah, they either retired or left the state.
And as you pointed out in your research, just in 5 years, 40% more, those that we have, could be retiring. And my physician, I love her up in Santa Fe, and I try to be really nice because I'm thinking, I won't be able to find another doctor. And it's hard for me to be nice, by the way. But
we've got to make the state more attractive to retain the doctors we already have and to attract new ones. And the legislature's been doing some good things, but there's more that needs to be done. And we basically threw the kitchen sink at it and came up with a 10-point plan.
And we're going to talk about, of course, the plan, but also the problem. But getting back to my question that I didn't allow you to answer. Why are we doing it this year? Why didn't we do it sooner? Why didn't we do it sooner, think New Mexico?
We should have done it sooner. And I have a lot of people saying, we've been doing this for a quarter of a century, and they said, of all the reports you've done, this is the most important. And they say exactly what you said. You should have done this 10 years ago. And it is an issue where you can't kick the ball down the street anymore. The longer we wait, the harder it is to address and solve these problems.
No, and I just say that kind of jokingly, wanting to do the sewer, but because I'm appreciative, and I'm just trying to make the point, this is serious stuff. And we appreciate Think New Mexico bringing this to the table because, again, I experienced this. And I fear, as I age, the future, my future, and again, my viewers' future. So let's run down some of the numbers first on how horrible it is. But anecdotally, we know we can't get in.
Right.
You can't get these, one procedure, they said 8 months. Okay, enough about me. What are the doctors? 30%, we lost 30% of those remaining, they could retire. They don't want to come here. So tell us about the numbers. We're not just talking about doctors, but nurses, technicians, surgeons, psychiatrists, occupational therapists, physical therapists.
I'm so glad you made that point. It's not just doctors. As you point out, it's nurses, it's, OBGYNs, pharmacists. Probably our biggest deficit is emergency medical technicians. We're about 5,000 below what national benchmarks say we should be at. And you wanted a statistic. The one that I think is almost the most poignant is 32 of our 33 counties are below national benchmarks, where we should be for the number of, in this case, doctors. But you're right, it's not just doctors, it's almost every category of healthcare provider, we have a deficit.
We have a deficit. We do have a medical school. UNM has a great medical school. I think it started in 1964.
That's exactly right.
So we're producing some doctors here, but we know there's an exodus of doctors. So you gave us the numbers. All the counties except I think Los Alamos we're on par with other counties in the nation for having enough physicians. Now we can't all drive and move to Los Alamos, but locally, I mean, in Albuquerque, Santa Fe, and then the outer communities, rural New Mexico is even worse.
The most dire shortages are in the rural parts of the state. I mean, it's just untenable in some of those places. But it's bad everywhere, except, as you point out, Los Alamos.
So, and again, I point this out because I read about it all. It is great. 54 pages, what? About
56.
56 pages discussing. I mean, this is serious research.
2 years of research.
2 years of research, not just Fred, but a number of people on his staff did this research. So we know it's dire. Personally, we know. We know what by the statistics that you found in this research that you did in the past 2 years. Why is it happening?
Well, I think some of it's demographics. We're a relatively older state than most states, and we're a relatively poor state. So those factors are at play here. But there's so much that can be done. You know, when we went through the history of the doctor shortage in New Mexico, a lot of this can be affected either positively or negatively by government action. So the good news is a lot of this is fixable.
Because government action took a part of it.
Well, you gave the example of UNM Medical School, and you're exactly right. It was started in 1964, and as you can imagine, when that came online, that reduced the shortage that the state was experiencing then and brought it up to a point of equilibrium. Unfortunately, since then, we haven't really kept up.
We haven't, and I was saying that I was reading this, I thought the history was interesting, and a lot of people know, because when I first came to New Mexico, many decades ago, the last millennium, people would say, well, remember New Mexico was kind of a haven for people who like the high, dry altitude.
Because of tuberculosis.
Tuberculosis. So at that point, in the early, I think it was the 30s, 40s, maybe 50s, they all came here, and then we got a shortage of doctors then, too.
Right.
But I think more doctors came because they had the patients. So it's been kind of a up and down story. But government policy has a lot to do with it. Because
Correct.
we know environmentally, culturally, our food, and of course that sunshine, people would love it. It's a healthy place, the high altitude, the fresh air. I mean, athletes come here to work out, work on their strengthening their hearts, their lungs here in New Mexico. So who wouldn't want to live here?
Exactly.
Except for the doctors and medical professionals.
Yeah, there's much to be done, and some of these things, like I said, the good news is there are things that the legislature and the governor can do in this upcoming session that would begin to address this issue, like the interstate healthcare worker compacts.
Let's talk about that. You've got 10 points that you've presented. The legislature is on here. You're working, you're going across the street, you're lobbying, you've written the legislation, you have a 10-point plan that's very easy. People couldn't find more. We're going to do 2 parts on this show about the serious topic, because it's seriously life and death. 10 points. They can easily go into your webpage to get more details. Where can they find this 56 page?
They can download it right off of our website. So www.thinknewmexico, written out as one word, .org.
Easy.
And just go to the policy reports and they can download
to find
it.
that. So you feel, again, 10 points, and we're going to try to cover some of them in this program and in the next program. But the compacts.
Yes.
Tell me a little bit about that.
Okay, so there are...
and why it's so important.
This is probably the most important thing we can do in the short term to address the shortage. So there are 10 major interstate healthcare worker compacts. So one for doctors, one for nurses, EMTs, and so forth. And the way they work is sort of like the driver's license system, where you're licensed in one state, but you can drive in all 50. And the idea here is to make it possible for doctors, for example, to be licensed in one state, but to practice in all the states where there's a compact. The way to join the compact is to get your legislature to pass a law saying we agree to the terms of the compact, which is like a contract, and accept the licensing of other states. And there's all kinds of safety protections in there. So if a doctor or a nurse has been disciplined, there are ways to take that into account so you're not...
So if you're licensed in Texas to practice, and you're a member of the compact, then you could practice anywhere in the country.
Correct.
And I imagine a lot of other states have really high standards.
They do.
I mean, compared to New Mexico, who tends to always be at the bottom of things.
And
so we're not a member of this compact.
So there's 10 compacts. We're only a member of one, which is the nursing compact. And there's 9 that we'd like to see the state join, including the doctor compact. And when you look around the country, we're one of only 5 states that are in 2 compacts or less. If you look at our neighbors, Colorado's in all 10, Utah's in 9, Oklahoma's in 8, Arizona's in 6, and Texas is in 5. So we asked ourselves, this is such common sense. Why hasn't this happened? And it's not for lack of trying. There are a number of legislators who have been trying year after year. The argument that's made against it is that if we join these compacts, we would be sacrificing our state sovereignty, as if our licensing system is so much better than every other state. I'm not sure that that's the real reason that these are opposed. In the compacts,
but we allow motorists from other states to drive here, right? To come
Yeah.
here. We allow them to come here,
and just
but we don't want to accept these medical
right.
compacts.
And just to illustrate how important this is, there's a case in Santa Fe, where I'm from, where a couple had a child who had a very rare and aggressive form of cancer. They took their child to UNM, and UNM said, "We've never seen this before. We're encouraging you to get a second opinion," because they were trying to make a decision whether to amputate the child's hand. So the parents called all around the country. They found some specialists in Michigan and Pennsylvania. They called those specialists and they said, "Bring your child." They couldn't, because the child was having chemo and couldn't go through an airport. And they said, "Well, can we just do this over the phone, like telehealth?" And the doctor said, "Well, your state is not part of the compact. If we give you advice over the phone, we're really practicing medicine in New Mexico without a license." Ultimately, what this couple had to do is drive to Texas to have a telephone conversation, because Texas is a member of the compact. New Mexico isn't. So it would just make it so much easier for New Mexicans to get health care if we could join these other 9 compacts.
Want to share what you think is a real reason, other than our standards aren't so lofty that we can't accept physicians from other people, other places?
It's run into trouble in the Judiciary Committee, and it's been suggested to me that in each of these compacts there's a section that says we have a board of governors and they are exempt from lawsuits. And
we have a board of governors
who governs the compact, and they're exempt from being sued. And the trial lawyers, I think, don't want to have that precedent that any one group of citizens can be not sued. So I think that's what's going on, but I guess we'll find out as we bring these compacts forward in this next session.
So you've sat in the session, the Judiciary Committee. They've discussed this before. And what's
repeatedly.
Happened? What's happened?
It either doesn't get heard or it gets defeated in the Judiciary Committee.
So this would affect us immediately. And I think we all probably know about this regarding the nurses. Who hasn't heard about traveling nurses coming to New Mexico, right? I mean, we've all heard about it. We've heard about how much they get paid, but because they're part of the compact.
The nurses compact is the only one that New Mexico is a part of. So we researched that and said, well, what makes that one different? And apparently about 17 years ago, when it was first agreed to, it was a huge fight, but the rural hospitals were able to prevail and say, if you don't pass this compact, several of our hospitals will have to close. And so there was a real crisis. I hope we don't have to wait for a crisis with these other compacts for behavioral health providers, doctors, emergency medical technicians, which I mentioned. We have a terrible deficit of about 5,000 of these. So anyway, we're optimistic and hopeful that we've got legislators working together now, and I think we might be able to get maybe some of these compacts through.
And that could turn things around.
That's the single biggest thing if you want to have an immediate impact to boost our numbers of all types of healthcare providers, would be to join these compacts.
And the nurses have affected things that have kept hospital doctors' offices open.
And hospitals running, yes.
Because there have been threats, I think, Las Vegas, and I think in Gallup.
Raton, all around rural New Mexico.
They're possibly closing, needing to close, because they don't have people staffing them.
They're struggling with getting staffing, and we'll talk about, I guess, in the next hour or the next half hour, the medical malpractice system. But malpractice premiums for hospitals have been going up tremendously, and that's having an effect, and they're struggling to keep their doors open. And the one in Gallup lost a $58 million judgment, and they're facing bankruptcy.
Oh, yeah. I read about that. So compacts, it worked for nurses. Why can't it work for the other 9?
Exactly.
Wow. Never got really an answer. Why? But now you're working on getting the answer.
We'll find out what the real answer is.
So we've heard about permanent funds.
Yes.
We've got a lot of money in the state. We're a poor state, but there's a lot of money due to the oil and gas industry, taxing them, the price of oil and gas, how much we produce. I heard now we're the second largest producer next to Texas. I think it was
That's
North
right.
Dakota, now New Mexico. Our state is the second highest producer, and we tax the heck out of it. That benefits all of us.
Yes.
So we've got a bunch of permanent funds for different interests. Now think New Mexico wants a permanent fund for?
Healthcare. It's the second biggest expense in state government, but most significantly, healthcare expenses are rising like this, on average about 7.5%. Government revenues only rise, if you go back 50 years, about 3% on average. So there's always going to be this gap. And if everything else is static, you're going to either have to raise taxes or cut essential spending on programs that we need. So a good idea here, we believe, would be to create a healthcare permanent fund from those one-time oil and gas monies that would be invested by the State Investment Council in things like the stock market. Now, the stock market goes up and down, but on average, the return's about 10%. And that would help close that gap in healthcare spending. And the single most important expense that it could be used for would be Medicaid reimbursement. When you talk to doctors, you hear over and over again about our low reimbursement rates. Now, the legislature deserves a lot of credit because they've been working hard to raise those in some areas. But in many areas, doctors will tell you they lose money on every Medicaid patient that they see, and that shouldn't be.
We're the second highest of Medicaid percentage of people on Medicaid in the country.
About 42%
of all the patients.
Of the patients are Medicaid patients. But here's the good news. If we created a permanent fund like this, and let's say $2 billion, at a 5% draw, that would be $100 million that could be used each year. The federal government matches the state 3-to-1. So that would be a remarkable return on investment where in the first year, you could draw $100 million and get it matched 3-to-1. Now you'd bring in $300 million into the state to help lift up our Medicaid reimbursement rates. So and the legislature deserves credit. They've been using this oil and gas money that's been coming from the permanent fund to create, which is coming from the Permian Basin, to create these permanent funds. And last year they created a $1 billion fund for higher education, $300 million for the environment and for conservation. And like I said, healthcare is the second biggest expenses in state government. It's the fastest growing expense. So we think it's time to create a healthcare permanent fund. The good news is George Munoz, who's chairman of the Senate Finance Committee, has already been working on this issue, and we're hopeful that maybe this session, where once again they have a multi-billion-dollar surplus, that some of those monies could be put into a new permanent fund for healthcare.
I think we have about $800 million new dollars this session.
That's for recurring dollars.
Okay, recurring.
Yes, and they've got about $2 billion of one-time monies coming from oil and gas, which really should be treated not as recurring, since oil and gas is a sort of boom and bust industry. So we're hopeful that maybe a portion of that could be used to start a healthcare permanent fund. And you know this history from the legislature. The first fund that the legislature created was about 50 years ago when they created the severance tax permanent fund. It started with $7 million. It's now about $10 billion.
Wait, 7 million?
Yes.
And now it's 10 billion.
Now they continue to put money into it, but they invested it through the State Investment Council in the stock market and other assets. And with compounding over time, even though they were making distributions, it's now about $10 billion. It produces every year for the general fund about $500 million. That's $500 million that the legislature would have to raise taxes on if it didn't exist. So
And that's going towards what types of things?
everything in the general fund, mostly education. So it's really critical to the state's economic picture to have that trust fund.
These permanent
And if
funds.
we could start a healthcare fund, it would help not only these current problems, but way in the distance when we can no longer draw from oil and gas.
And then again would go to doctors to help the difference between what their services are and what Medicaid allows them to charge the patient.
Right, and it can attract money from the federal government to help with those Medicaid patients.
And with that, you believe more doctors and medical people would come to the state because they'd have a higher reimbursement rate from Medicaid.
It would make it more attractive. Doctors shouldn't be losing money when they're providing health care for Medicaid patients. They should at least be breaking even, and this would allow for that to finally happen.
Fred Nathan Jr., the founder of Think New Mexico, glad we have a half hour to talk about all this because you've got 10 points and we got through 2. Thank you for being a part of this program. Tell folks again how they can find more information regarding Think New Mexico's proposals to solve the healthcare worker shortage in New Mexico and why we need this.
So they can do 2 things on our website. First, they can go and get a copy of the report under the policy report section, and then they might want to contact their elected officials. And you do that by going to the Action Center on the website. There's a pre-scripted letter that can go to your legislators, the governor, the lieutenant governor. You just type in your address and the computer figures out who your representatives are. And we have no pride of authorship, and I would encourage your viewers to erase it and just talk about their lived experience. And
like I did. I mean, I'll do
their
that
trouble either finding a doctor, if they have a doctor, getting in to see that doctor.
You've given us some hope for a very sick problem we have in the state. Thanks for watching. I'm Diane Kinderwater. My guest today, Fred Nathan Jr. with Think New Mexico. We're going to have more about this serious problem and solutions in our next show. Stay with us. We'll be back. Bye-bye.
Issues and Answers with your host Diane Kinderwater is presented as a public service to inform, educate, and better the lives of New Mexicans. To comment on today's program, email us at info@kchftv.org or call us at 505-345-1991. Join us again for Issues and Answers with Diane Kinderwater.